Okay. Hello, everyone. It looks like we're just at noon, so it's time for us to begin our discussion today. My name is Tim Seiber. I am an associate professor and the director of the Johnston Center for Integrative Studies here at the University of Redlands. And my background is in medical imagery and medical anthropology. And so I'm very excited today to welcome you to our discussion with Dr. Terry Cullen, who graduated in 1978. With you just briefly, part of her background, Dr. Cullen is a family physician who retired from the U.S. Public Health Service as Rear Admiral in 2012 after leading multiple software development and deployment initiatives within the Indian Health Services, including 5 years as the CIO for the Indian Health Services. Dr. Cullen then worked as the Chief Medical Information Officer administration. She worked to develop a new model for field and community involvement in health information technology. Her 5 years work at Regenstrief Institute focused on the utilization of appropriate technology to meet identified clinical needs and improve health outcomes, as well as using standard vocabularies to improve clinical care. She is currently Pima County Health Director in Arizona. So that is quite the career, and I'm very excited. I feel like I could talk to you for hours and hours, but I know you're very busy these days, so we'll just have about a 30-minute conversation. So welcome, Dr. Cullen.
Yeah, thanks.
So I want to get around to today's urgent crises and how your work interfaces with COVID and healthcare provision for minority communities. But we'll get there in just a few minutes. For a second, of course, I want to just talk about how the two of us are talking, which is that you are an alum of the University of Redlands, and in particular, the Johnston Center for Integrative Studies. So just in addition to your professional background, could you tell us a little bit about how in the middle of the 1970s you ended up at Johnston?
Well, I had a journey. I actually had gone to a community college, and then I went to University of California, San Diego, Ravel campus, where I was pre-med, and dropped out and actually was a community organizer for the United Farm Workers. And then I went back to Arizona, and I met the recruiter for Johnston College when I was at the small community college in Arizona. And he said to me, I think you fit great at this college. And I said, really? I've never heard of it. And I went, and it was when Johnston, so my degree is actually from Johnston College, not from Redlands, because it was when we were an independent accredited college. And I went, and it was marvelous. I studied philosophy and biology. I did my own learning path, as you do at Johnston. There was then, as there is now, a real commitment to cross-cultural experience and to social justice. And so aligned totally with what I wanted to do. What I say to people is Johnston taught me how to think and how to speak and how to write, all skills that have been critical to everything I've done since then.
That's really fascinating. And I think for many of our alums and current students, they have similar unique pathways into the place. It's not a traditional institution like so many colleges and universities. You mentioned that you studied philosophy and biology, two areas that I'm very interested in. Can you say a little bit about how those two ways of thinking merged for you? They can often be thought of as quite different from one another. And so I understand that Johnston gave you the opportunity to think simultaneously in both manners. So can you just talk a little bit about that?
Yeah, you know, and it was interesting for me because most of my science classes, well, many of my science classes I took on the main campus. And then but I did things like physics and calculus at Johnston, which people don't think you could do at Johnston, but I did do at Johnston, and it was wonderful with the professors. I had very small classes. I learned an incredible amount. But I think Kevin O'Neill was one of my advisors, and I think he was really the one that showed me, especially in a horrible class on Kant and Hegel, because it was so hard, how thinking and learning how to think with precision and analysis was critical. And then I developed the ability to do some integrative work. I did some work in sociobiology and ethics with Dr. Bowman, and I was really able to see the cross-cutting nature of what primary care is about and why you would do it, and the benefit of having develop the skills that Johnston allowed me to develop, specifically in terms of analysis and critical thinking. You know, a lot of medicine, that's what it's about. If you think of medical decision making, it's taking a lot of different ideas and knowledge and doing a synthesis, recognizing a pattern, being able to apply some additional knowledge to that pattern to see if that is what's wrong with the person in front of you. So there's a huge embedding of the social, the political, the philosophical, spiritual in that decision-making process.
Is what you've just described what some people today refer to as holistic medicine?
Yeah, I think so. I actually think it's beyond that, though, because I think the way we've used the terms holistic medicine is, oh, I pay attention to your emotions and I pay attention to spiritual needs as well as your physical needs, all things that are very, very critical, right? But I think my perspective from Johnston enabled me also to see an individual within the context of the community and within this larger context of what impacted that person that day. And some of it is obviously from a philosophical perspective, what are the principles that are used when you make medical decision making? Some things that are not inherent in medical training. I would say even today they're not there because we have such a focus on, you know, that it's a biological process, and it's obviously not just biology.
Sure. Yeah, I just have one more question on this topic, and then I'll move us to the present moment. And that question is this: I advised a student this year. She graduated with her emphasis in Johnston in global biomedicine, and she's now applying to medical school and has been terrified in one way and one way only, which is that she feels like maybe medical schools won't accept her Johnston education as legitimate because she didn't follow the traditional pre-med track. And I know that you didn't either. And so I was just wondering, did you experience resistance to your education legitimate when you were applying to medical schools?
Oh, you know, it's a great question. When I applied my first year, I remember this a long time ago. And I applied with my transcript like this, my 150-page transcript, and I got rejected. And I went and met with the dean of students, who you could do at that point if you got rejected. And he said, look, you have great MCAT scores, you had great interviews, but nobody knew what to do with this. They looked at this and said, what do we do with it? And so I actually ended up translating, you know, you can translate Johnston into grades. But after that, it's interesting because my first year in medical school, I actually thought what you were going to say is that she was terrified that she wouldn't be as prepared as everybody else, because that's what I was terrified of. Well, my first year, there were some things I didn't know as well as I didn't know how to talk, which was really an important thing. But I ended up on the curriculum committee because everybody said, you know, you're the only one that seems to know anything about how you establish curriculum, what matters, how you take learners' needs into consideration when you make decisions about developing curriculum. So I was really an asset, I think, coming from Johnston to the class itself. But I do think people don't know what to do. You know, they really expect you to be you know, have followed a very traditional path. I think there's more and more people that haven't followed that path though now. And there is a recognition that, especially in primary care in this country, you have to have people with diverse backgrounds. The other thing I would say is, you know, to get into medical school, you have to stand out. You have to be a little different, right? Everybody else is the same. Well, coming from Johnston, with that kind of experience, you're from get-go, the time you apply, you stand out. And you can use that to really emphasize what value you bring to that medical school class.
Great, thank you. That's really interesting, and I think very hopeful for our current students who are interested in medicine, but may be a little bit wary of coming to Johnston for that very reason. So Okay, let's switch gears a little bit and talk about your current work. At the beginning, I read your bio to everyone, and that includes the fact that you currently serve as the Pima County Health Director in Arizona. Can you just tell us a little bit about Pima County and the population and what your job actually is there?
Yeah, so I just started June 1st.
Oh, congratulations.
Tomorrow it will have been a month. So Pima County, second largest county in Arizona, a little over 1 million people, 2 reservations, the Donathan Reservation and the Pasquayaki Reservation, the largest border with Mexico of any county in the US because it's mostly on the Donathan Reservation. Urban and semi-urban and rural. We are a mix of every geography that you could imagine. We actually also have the largest fire raging of any geographic place in the United States right now. Our Catalina Mountains, which surround the Tucson area, have been on fire for about 2 weeks now. So it's a wonderful county. It's very diverse, 47% Hispanic, African American, Native American, average income around $38,000 to $40,000. Our major industry is the University of Arizona, as well as Raytheon, which is a company. And then we have a lot of call centers. Spanish is, Telemundo is the #1 television station in the Tucson area. So lots of people where Spanish is their first language. So many things are bilingual.
And so what is the job of the health director?
So I'm the public health director, which is the director of the public health department. So it's the director. It's to figure out how we get a healthy community. It's actually a wonderful opportunity. Pima County is a very caring, compassionate community over the years. They know how to work together. Our philanthropic and social support organizations tend to really be committed to health equity and health justice. So my goal, my job is to try to work with lots of different groups to do that. But my real goal is to figure out how we get to help what we call Health 2.0. What's the next wave that would envision creating a healthier population, helping achieve health equity? We've taken to say in the last few months that everything we do through an equity lens, very apropos to the timing, but we were thinking about that long before the recent events because we wanted to make sure that when people talk about health justice and health equity, it really means that everyone has the same opportunity. Doesn't necessarily mean that we are able to eliminate disparities, so that is one of our major goals, but that we can ensure that every member of our population is able to access what they need now. And COVID throws a loop in that. I mean,
yeah, let's talk about COVID for a little bit. In our pre-conversation, I was mentioning to you that I had read some stories about how Arizona is now one of the not just national but global hotspots for COVID cases and COVID transmission. I'm sure as a public health director and dealing with populations who maybe don't have all the kinds of insurance or regular access to primary care and whatnot, you must be dealing with quite a number of needs that are not just biological but social and economic. So could you just tell us how, as a health expert, you addressed community needs?
Yeah.
More broadly.
Yeah, so our numbers are like this. If you're on a graph, they're just straight up going up. We just, our county board of supervisors voted to enact legislation that required masks about a week ago now. So we're seeing movement in that direction. But bottom line is our community transmission is at a very high rate compared to other communities. Lots of people are catching up right now, Texas, Florida, parts of California, but starting about 2 weeks ago, we just saw this dramatic increase. We've kind of been around where everybody had been 30 to 50 cases a day. Now we're seeing multiple hundreds of cases a day. What we are in the process of implementing, along with some of our partners, including Partners in Health out of Boston, has agreed to help us, is how we do case investigation and contact tracing in the context of supplying wraparound. So we don't want to just know that you have been exposed to COVID. We want to know what we can give you to help you stay at home, isolate appropriately, give you access to resources, and then help ensure 3 or 4 months from now, whether you develop COVID or not, that we can move you further along. So I never want to talk about COVID as an opportunity because it's a terrible disease, but it does create this situation where from a health department perspective, we can say it's more than just contact tracing, which you hear about everywhere, but it's really, if you are a contact, what do we do to help you and your family and your community? So part of that is doing testing in different communities that have reached out to us. It's recognizing that the community itself has multiple needs. You know, the needs of the people that live in the foothills are different than the needs of the people that live in our other parts of the town. We're working closely with both reservations to ensure that they have the services that they need from us, though both of them are really doing incredible jobs themselves. And then we've worked closely with our health department staff. You know that term, the coin of the realm. So when you're an academic, I came to this job from academics, and the coin of the realm, and you may know this, Tim, is publishing, right? Like, you need to, well, I don't know if it applies there, but you would need to publish. And so I came to this job really from an academic job where I have been successful lately, especially with publication. Well, the coin of the realm in public health is really empathy. It's how do I care for you? And how do I leverage that empathy to help address your loneliness, your isolation, your food security, your housing security, your job security, your just future security. I mean, I think COVID has thrown everyone for a loop. And when you look at the increase in rates from the 25 to 39-year-old, you know, you can be really dismissive and go, what are those kids doing? I think, and I have 3 children in that range. So I think young adults are saying, what is going on? What am I doing? I'm isolated, I'm alone. The things that that matter to me, that social networking, have taken a real hit, and how do I move it along? So part of our job is to make sure that we can appropriately interface with those groups.
Yeah, I want to just ask one more question on this topic, and it relates to, in part, to your description of Pima County at the beginning of our conversation, which is that it is a diverse county that serves Native and Indigenous populations, Black Americans, and also Hispanic Americans. And in the reporting that I have read, wide trends, those are 3 groups of people who are most affected by COVID in terms of mortality rates, coupled to joblessness rates and lack of insurance. And one thing that journalists and scholars have said is that this disease is exposing us to realities that were already true, that we're now, some of the tensions about inequity and lack of access to healthcare that were already true of our health system are now exposed. Have you seen that in the communities that you serve?
Well, you know, it's a great question. And we actually, you know, one way you get at that data is you collect enough demographic data that you can then parse your data and see, is there a difference, right? If you don't know racial or gender demographics, then you can't figure that out. If you don't know where people live, what their census tract number is, what do you do? We follow those fairly closely. What we do see is a small increase in mortality in American Indians and Alaska Natives in Pima County, nothing like they've seen up on the Navajo Reservation. And White Mountain Apache was just actually in the local paper today. So we know, but what I say there, and I spent years working on reservation with with American Indians, Alaska Natives, and what I say to people, I never said this when I was a federal employee, but I can say it now, you know, when there's almost a century of inadequate resourcing going to communities. This is what happens, that the inequities become starker when there's a pandemic, and that's what you see there. I think in terms of Pima County, what we've done is be very attentive to trying to collect appropriate information on our on people that have been exposed and or diagnosed with COVID-19, and then do some census tract modeling on them. We do see some what we would call hotspots. Some of them are related to long-term care centers, which are not reflective necessarily of gender or race, but more reflective of age. So we know that age itself is a risk factor. But I still think there's a lot to learn about this disease, where even though we're 4 months into it, 6 months into it, we're still early in the process of knowing how do we figure out if you're diabetic or hypertensive and you're a 25-year-old, if you're from a certain ethnic group, are you more likely to have morbidity or mortality? I don't think we know those answers yet. We know them with big buckets from a population health perspective, but then to push down into smaller populations, we don't.
Well, I hope as we learn more, we can develop more extensive medical practices to address these equity issues.
Yes, definitely. And I think the commitment for public health departments is and for the population to say right now is equity. The equity lens needs to be applied to everything we do, even if it's an afterthought. So you're already down your path, just stop and put some equity view on it and see what you can determine.
Great, thank you. I'm mindful of the time, and I've got 2 more areas I want to get to. So we haven't gender yet, although you did mention it in one of your statements about risk factors, and kind of interested about what your experience of going to medical school and then becoming a practicing physician and then working your way up different bureaucratic institutions, what it was like to be a woman and a doctor and working in leadership in the 80s, 90s, and today, and if you've seen things change, and if you could just tell our alums that.
Yeah. So, when I went to medical school, 8% of practicing physicians in the country were women. Now it's almost 40%. So huge difference. Only 15% of my medical school class was women. It dramatically changed fairly rapidly after that. Now, more than 50% of medical students are women. But I had that experience. I had the experience of many times being the only woman in the room. I got into health information technology, so I got into software. That meant I was really the minority. There were very few women. Many times I remember I'd walk in the room and I'd go, I'm the only woman. I actually remember a meeting at Health and Human Services in Washington, D.C., where I must have been very, very tired. And I walked in and I opened the door and there were like 30 men. And I said, oh my God, I'm the only woman. And all these people turned around and looked at me and I said, I think that's right. I know, because I had to make it into a joke. So there were issues. I don't want to minimize it. It was really hard. And many times I was the only woman with children. So then I had a family. My husband was Mr. Mom. He's wonderful. Our oldest daughter is 32, and she says, my dad was the only one that came to pick me up. Everybody else had their mom, and you were out working. And, now we're over any kind of madness she might have had at me at that. But, I think it's different now. I look at I have 2 daughters and a son, and I look at my 2 daughters and I think, they're lucky. They still encounter some things, but it's nothing like it was before. And I feel grateful in many ways that I was able to be that woman and to be that voice. I retired from public health services as Rear Admiral. I was the 12th woman to be a Rear Admiral in public health service, and it was a privilege. And I got there because I had amazing mentors, many of whom were men, but I also had men that who were my mentors who really supported me in my career, and I feel lucky that I had that.
Great, thank you very much. And okay, I have just a last couple things before I let you go. I know you're very busy, and so I kind of want to end where we began. We talked about your degree and the academics of your Johnston education, but I first want to ask if you had any nostalgic memories or just about the social life or the world or the education that aren't necessarily about your courses, but just about like being a Johnston student and what it was like.
Yeah, you know, it was transformative for me. It's probably one of the main times in my life where I went in one way, like in a little cocoon, and came out really different. I had a wonderful peer group, many of whom I'm still in touch with. Actually, my best friend from college recently passed away from Johnston, and we were at the last Johnston reunion together. So I feel like who I have been in the world is because of what Johnston let me see about myself. But I also think, Tim, it gave me this sense that I could be different and still be okay. Like lots of support for what I believed, and I could speak that. When I applied to medical school, I remember I asked a professor at Johnston, I said, you know, I want to write what I believe on this medical school application, and I'm worried I won't get in if I do. And he said, well, if you write what you believe and you don't get in, you probably weren't meant to be there, Tara. So I did that. So like, how powerful is that, right? Like this is what, a very long time ago now, like, you know, for 42 years ago. And I still remember that day. I still remember the day that he said, be true to yourself, even though he didn't use those words. And that's what I felt Johnston gave me. You know, and I don't know that I would have gotten that anywhere else.
Well, I will be certain to pass along that wisdom, advisees. So just before I let you go, if you could give one or two pieces of advice to either students who might be interested in Johnston or current students who are thinking about graduating and going out into the world, this is your kind of free form opportunity to share your wisdom.
So there's a few things that I know have really helped me. And one of them is what I just talked about. And it's an old adage, and everybody knows, be true to yourself. But it's really critical, especially in today's world, I think, to find your foundational principles, your foundational love, what lets you center in the planet, and stay with that and move along. The other thing is, and I could give you lots, but one other thing is what I said earlier, you know, this ability to speak and read and write, even if you're on the computer all day, is invaluable. And it is a skill set that I have lots of people that work for me, a skill set that many people leave, even master's and PhD level, without having conquered. And the ability to gain that knowledge, information is so important, and it will be skills that stay with you forever. And then I think the last thing is, you know, I have this a saying that I developed for myself. I think I was probably in a, you know, in a hard space. The other thing I should let people know is I cycle. I can get pretty impatient. So after 4 to 5 years, I have to change jobs because I've done what I needed to do. And then I'm like, come on, let's just go faster. Let's make the world better faster. And sometimes that doesn't work. But it's this adage I say to myself a lot, which is to be strong, to be brave, and to be kind. Those are 3 hard things to do together. And I remind myself often that if I can figure out how to do all 3 of them at once, I'm going to really help make the world a better place. Yeah.
Well, that I think is an excellent place for us to wrap up our conversation. I just want to thank you for your time and your really thoughtful answers to my somewhat oddball questions. And
That was great.
I hope that you enjoy the rest of your afternoon, and I look forward to seeing you at a Johnston reunion sometime soon.
Yeah, and thanks so much for the opportunity. I would just tell people, Johnston, it has a large piece of my heart. It helped make the world better.
Great. Well, thank you, and enjoy your afternoon. Goodbye.
Yeah, thank you. Bye.